welcome to Life Care Hospital's live sessions on fibroids and fertility. Today we have with us Dr. Amol Gadgil, a highly experienced gynecologist who has been practicing for over 15 years. He has treated and managed numerous patients with fibroids and fertility issues, and is here today to share his knowledge and expertise with us. Good morning, Dr. Gadgil. Thank you for joining us today. Can you tell us a little bit about yourself and your experience with fibroids and fertility?
Good morning, Robert. Good morning, audience. It's a pleasure to be here today. I'm a practicing gynecologist for last about 30 years now, and I have come across a range of patients who have patients with range of complaints related to fibroids and fertility issues. My approach in treating them has always been to give them the best possible care by providing them with the latest and the most effective treatments available and guiding them as to what suits them best, because the treatment has to be tailor-made for each and every of my clients, because that's the best way forward for them.
Thank you, Doctor.
That is how we go about it. Yeah.
Thank you, Doctor. I would like to step back just a little bit. For the larger audience, what are fibroids and how do they affect fertility?
Fibroids are essentially, they're not cancer. That is the first thing that we must explain and stress when talking to our clients, that they're not cancer. They're non-cancerous growths that develop in the womb. Womb is uterus, of course. And they are also known in medical terms as uterine myomas or leiomyomas. They can be of varying sizes and they can be at various locations inside the uterus. And essentially, it would be the location that would decide the kind of presentation that the woman may come to the gynecologist with. It could be heavy menstrual bleeding, it could be pelvic pain, and based on their location, particularly if they are deep inside the womb and pressing on the innermost layer of the uterus, what we call as endometrium, or on the fallopian tubes, etc., to block them, then they can definitely affect fertility, because they are really obstructing the path for the fertilized embryo to get to pass through from ovary to uterus and then to get lodged in the uterus by mechanically blocking in many cases in that sense. So we need to be really knowing about the fibroid size, and that is how they would size and location, that is how they would affect a woman's fertility.
Doctor, let me ask you, how are fibroids diagnosed and what are the treatment options available?
Fibroids, typically many women come with only infertility as a symptom, and they may not have any other symptoms to start with. Of course, there are other symptoms with which they may present, which could be heavy painful periods, heavy frequent periods, and chronic pelvic pain, as we call it. These are few of the symptoms with which a woman can present. But the diagnosis is made on thorough clinical examination, including a pelvic examination. And of course, ultrasound has been a great assistance in picking up these fibroids. And once we know about these particular fibroids, the ultrasound can give us some idea as to the location and the size of those fibroids. In many women, we may advise even a further investigation like a CT scan or even an MRI if the fibroid is really large, causing some pressure symptoms even on the kidneys or so and so forth. And of course, if we have to do mapping of that fibroid to know if we need to surgically remove them. So the treatment modalities really start with, the diagnostic modalities really start from clinical examination and can go right up to an MRI examination for mapping. That is how we go about it. So we can plan our treatment accordingly.
Thank you, doctor.
That
That
is
is a lot of details. Quick question. Are there any common misconceptions about fibroids or around fibroids and fertility? And as a medical professional, how do you address them?
uh, first up. Uh, First of it, it is many women are afraid that it is a cancer, which it is not, as I explained earlier. So that is the first misconception that needs to be out of their mind.
Mm,
Secondly, they feel any fibroid, each and any fibroid will need to be treated. Not always, but there are fibroids which can cause infertility. And again, another misconception is each and every fibroid is a potential cause for a infertility. Well, even that is not true, because many
mm,
a women with fibroids can conceive, and not just conceive, they can carry a pregnancy to full term. Of course, it is quite possible that fibroids can interrupt a pregnancy. That is, they can cause a miscarriage, particularly in second trimester. They can cause something called as malpresentation. So, what we call as a breech presentation towards the end of pregnancy. They can cause transverse lie and so forth. So, not all fibroids, as I am saying again and again, not all fibroids, not just they may not need treatment, but they may not also cause infertility. Of course, they may cause some different problems and presentations. Like sometimes the baby may grow to full term, but may not be allowed to come through the birth passage because the fibroids are obstructing or blocking the birth canal. So fibroids have a varying way of presenting themselves or causing problems with fertility and fertility related issues, if you want to put it that way. So it can be ranging from infertility to subfertility to challenges of continuing with a pregnancy to term. So fibroids can give you across the range challenges with fertility, but not infertility alone. That's what I'm trying to stress.
mm,
So it is important for a woman, once she feels that there is something out of place for her, that she should be consulting her gynecologist, so seeks a proper medical advice, and then is reassured about the fibroid and the possible treatment that may or may not be required, or the possible sequelae coming out of the presence of that fibroid, resulting from presence of that fibroid going forward. That's what I would put it. That's the way.
okay. Yes. Doctor, as a gynecologist and an expert on fibroids, and how, what advice would you give women who have already
Uh,
been diagnosed with fibroids and are trying to conceive?
as I said, once a woman is diagnosed with fibroid, the first and foremost thing is to reassure her that having a fibroid does not exclude a pregnancy. That's the first thing
Mm,
she must realize. As I was elaborating earlier,
yes.
that she can conceive, she can carry a pregnancy to term. All that she will need possibly is a medical assistance. Now, the medical assistance can be uh, can also depend on the size of the fibroid, location of the fibroid, and so forth, and the actual pressure symptoms, etc. If it is causing any. So, in such a case, we may advise medical treatment followed by surgical treatment, or medical treatment alone. So the patient has the essential part of it is the patient has to seek a medical advice and a proper medical guidance at that once she is diagnosed with fibroid, because having a fibroid, as I say, I'm repeating again and again, possibly ad nauseum, that having a fibroid does not exclude fertility. All that it means is that the woman may need assistance to conceive. And as I said, the assistance will come in the form of various treatment modalities right from diagnosing various diagnostic modalities which I stated before, and of course, as I said, medical assistance, surgical assistance, and post-surgical assistance if required. They can be assisted even with what is known as artificial reproduction techniques, etc.
Okay. Doctor, in your experience, are there certain factors that are common to developing fibroids, and how can women reduce this risk if there are certain factors? So, for example, is it to do with age, or is it to do with the type of body? Can you elaborate on those, what we consider risk factors?
Um, the exact etiology, as we say, the cause
Mm-hmm.
for how a woman develops fibroids is really not known, to be honest.
Mm-hmm.
However, there are certain factors which can be considered as a higher risk factor, on which should alert us or the woman to the fact that she can be a candidate to develop a fibroid. So those risk factors or those predisposing factors, more aptly speaking, can be her age. Of course, a woman in the reproductive age is the prime candidate for that. Then, if she has a family history of fibroids, like if particularly a mother, aunt, or immediate maternal lineage, anybody on that side, if those ladies suffered from fibroids, then plump women and slightly obese women tend to have a slightly more predisposition towards fibroid because they also tend to have a slight hormonal imbalance. Then women with low parity tend to have more incidence of fibroid. So women with just one or two children are more likely to land up with a fibroid, or even women who never conceived, who never became a mother. Those women are more likely to end up with a fibroid. And of course, there are certain races like sub-Saharan Africa. This is a very potential potential race as such across the board, where I mean across the board, across the countries, nationalities, you could say, wherein the incidence of fibroid and not just incidence but also the size and the number can be more. So these are the common factors, common predisposing factors, you could say, that can lead or alert us to the possibility of a woman getting a fibroid. That is,
Doctor,
that's what. Yeah.
thank you for that. One of the most common questions is around treatment. Can fibroids come back after treatment? And if so, how can they prevent? How can they be prevented?
Well, uh, fibroids, even if we remove them, they always can reoccur because the essential part of it is fibroids, they grow in a uterus, and so long as a woman's body harbors a womb, a uterus, and particularly in reproductive age group, there is always a possibility that even after removal and exhaustive removal of all the fibroids, if possible, she still can have a recurrence of fibroids. That is, still fibroids can regrow in her. Of course, it's not a certainty. It's not a certainty that she will get a recurrence, but there are chances that the recurrence can happen. What we can do is, during the surgical procedure to remove fibroids, we can be reasonably diligent to remove as many number of fibroids as possible, so that the remainder of the womb is normal and left intact. Secondly, the like I said, certain factors like race, etc., may not be in our hand to control, but the other factors like lifestyle, like controlling weight, like having a healthy diet, like exercising regularly, and after surgery, following up with your gynecologist for regular monitoring and regular checkup. Those things would go a long way towards I can't say prevent exactly, but at least reduce the incidence of recurrence. And if a recurrence is happening, then at least we will be able to pick them up early. So if we are able to pick them up early, we are able to handle and treat them early and more effectively without causing much of a problem. So uh, I can, as I'm repeating, recurrence we cannot prevent or we cannot predict, but we can certainly reduce its chances by modifying our lifestyles and controlling weight, etc., etc.
Okay, thank you for that insightful answer. Uh, Doctor, in terms of women's health here, and from what everything you've told us today, um, what are the long-term effects of fibroids on a woman's health, and what is the management advice that you can give or share with the women in that regard?
Uh, okay. Long-term sequelae or consequences of a woman harboring fibroid are typically seen in women who have been living with the fibroid either undiagnosed or have have been too scared to take any kind of medication or treatment for for those fibroids. Those are the kind of clientele in whom you will see fibroids causing long-term sequelae in particular. Of course, this doesn't mean that women with large fibroids which were diagnosed quickly will not have any consequences or something, but they're less likely to suffer or land up with these kind of sequences or sequelae. And many of them would, in fact, present with heavy periods, heavy menses which are regular with clots, and those heavy menses can eventually land the woman with anemia, and it can be a chronic anemia wherein I have seen women uh, with hemoglobins as low as 4 and 5 milligram percent, that is per deciliter, and those women really need transfusion, multiple transfusions in fact, and then a serious treatment or handling of that fibroid on a war footing, because they will keep coming to you again and again just for the same complaint that they have heavy periods and they have chronic anemia. And anemia doesn't come alone. Anemia doesn't mean only loss of hemoglobin or iron, because when a woman loses blood, she is losing her proteins, her essential nutrients, and everything. So she tends to become what we could say as cachectic. That is, she has a loss of weight, anemia, loss of proteins, etc., etc. So it has multiple effects going forward in that way. Of course, besides that, she will also have a lot of pain given the size, going by the size and the location of that fibroid. She can have urinary bladder symptoms, that is increased frequency of, I mean, rather desire or urge to pass urine, or feeling of fullness in the bowels. And in certain women in whom they have really chosen to ignore that fibroid, because fibroid after a particular size of growth tends to be easily felt by the woman herself from her from outside by feeling her tummy. And even at that point of time, if she chooses to ignore, there can be pressure symptoms on the ureters, that is the tubes which carry urine from kidney to the bladder, and that can have a back pressure effect on the kidneys and leading to serious kidney pressure damage symptoms.
Wow.
So that needs to be really looked into. So besides anemia, she will have pain, she will have symptoms because of the size of that fibroid and the location, and of course she will have infertility, Of course, that is in a way a consequence of that fibroid, but because of its very specific location, as I said, towards the endometrium, that is the innermost layer of uterus, or towards the fallopian tube, or by the size itself compressing, etc. So those things can lead to infertility. And if a fibroid is left unhandled or untreated, as I was elaborating before, it can actually lead to obstructed labor during childbirth, or it can actually lead to even uterine rupture, because the uterus will simply keep ballooning and stretching over it during the process of childbirth. So these are, and that can have a disastrous consequences as a result. Not just that the woman will end up with surgery, but also in a rare instance, the woman may have to sacrifice her uterus just to save her life. So these can have not just physical consequences, but also going forward emotional and psychological, as well as social consequences of having a fibroid and not monitoring or not seeking advice for it. I would put it that way, or let me put it the other way, or allowing the fibroid to go undiagnosed. That's a better way to go about it. Yeah, that's what I would say.
So, do you think
So to
these are
sorry, so to so to avoid these long-term sequelae or consequences, we certainly advise ongoing medical treatment and periodic monitoring for women in whom fibroids have been diagnosed or picked up. That's what that is the way to go about it. Yeah.
Thank you, Doctor. Uh, an interesting question here on the board. Can fibroids be treated without surgery, and what are those non-surgical options?
Okay, fibroids, yes, they can be treated without surgery, but we must realize any medicine or any medication, whether it is an injection or a tablet or anything, it does not dissolve the fibroid, as we say. It will essentially alleviate the symptoms, reduce the size, and so forth. Of course, as I said, we can put them broadly into two or three types. The treatment modalities, what we call as non-invasive treatment modalities, or non-surgical invasive modalities, as you may put it. First, of course, is hormonal treatment, which can be combined oral contraceptive pills in very basic cases, just to control the bleeding, where the fertility may not be an issue, but just the bleeding, and even the fibroid size may be small. Or we can advise them with certain other type of medicines, which the tablets, which a woman may need to take for significant period of time, say about 6 months or 8 months, for the fibroid size to reduce. Then there are certain hormonal injections which will induce what we call as amenorrhea, and by that, of course, of course, those injections will induce some hormone changes. So the fibroid size naturally will reduce. The fibroid size can go down by as much as 20 or 30% in such women. Of course, those injections and those pills are particularly advisable in women who are desirous of fertility but are not fit to undergo surgery for some reason. For example, they could be anemic, so we need to build them up, we need to control their menses, and so forth before we take them up for surgery. So, such women may need medical treatment before undergoing surgery. Then there are certain women who may be not fit for surgery because of some other reasons. In them, we can offer them something like uterine artery embolization, which is not exactly an invasive, but a procedure wherein we put blockage aliquots in the uterine vessels, so that the fibroids they cease to grow in that way. And of course, there are certain other modalities like HIFUS, as we call it, that is high frequency ultrasound, and even they are known to reduce size of that fibroid. So these treatment modalities are, as I mentioned much earlier, they are tailor made to suit each and every patient and to fit her physical condition, her constitution, her desire for fertility, uh, the age, whether she has completed her family, whether she is satisfied with her parity, and so forth. So there are lots of factors which go into offering such various treatments. But and the treatment has to assist her. Finally, the treatment has to assist her, whether for fertility or to improve her health. Of course, not or to for fertility and to improve her health. So that is how it would go. What suits the patient, each and every patient, is what is to be offered.
Doctor, talking about advice, for those women who are following us online and let's say they're worried about fibroids, or for those who are experiencing any number of symptoms of fibroids, I mean, what advice do you have for them and how can they seek help?
Uh, my advice to all women would be, if they notice something which is a deviation from normal, deviation from ordinary of in their lifestyle, in their lives, then they should be seeking, particularly when it comes to their reproductive life, then they should be seeking a medical advice at the earliest. For example, if they are seeking to become a mother, but if it's not possible for them to do so for whatever reason, in spite of giving themselves sufficient time, they should be seeking a medical advice. If their menstrual patterns change, say if the periods become heavy or if they become painful or both, then they should be seeking a medical help. So earlier they seek medical assistance, better we are in a position to help them, because that way we are able to catch the fibroids early and treat them, offer them better treatment modalities, so that the long-term sequelae, complications, etc., are significantly reduced, possibly avoided completely, and we can almost certainly assure, though of course not guarantee, nobody guarantees, we can almost certainly assure a improved lifestyle and an improved outcome going forward, whether it is for fertility and eventual fertility and conception, eventually resulting in a live childbirth, or whether to alleviate her anemia and the other symptoms. So, for all these things, if they seek medical assistance, as I said, anything which is deviation from normal as far as their reproductive life is concerned, if they seek early assistance, we are in a much better position to help them, diagnose them, and treat them. That's what I would. That would be my advice to them. Yeah.
Thank you
Please,
for all that
assistance early. That's all. In one sentence. Yeah.
in one sentence. That's all for today's live session on fibroids with Dr. Amol. Again, doctor, thank you for your time and the advice. To the audience, we hope you found this interview informative and helpful. Remember to you're experiencing symptoms or have concerns about your health. Thank you for watching, and we will see you soon. Thank you.
Thank you very much. Just a last word from me. The key takeaway for every woman would be, fibroids are not cancer. They develop in uterus. They can affect fertility, and for that, if they need to seek treatment assistance early. They should visit their gynecologist as early as possible, or a multi-speciality, multi-modality treatment facility like Life Care Hospital, where they can seek the assistance of people, so that the best possible care is available uh, at an early stage, and the outcomes are great at the end of it. That is what we desire for. That's what I would say. That, yeah. And of course,
I-
they need to maintain a healthy lifestyle, so we reduce chances of needing such an assistance in the first place. Let me put it that way. Yeah.
Doctor, again, thank you for your time and an amazing advice and a great interview. Thank you so much.
Thank you very much. Thanks for having me.